Hi guys, so today we are going to be going over our global healthcare systems policy project, and the country that we chose was England. In my group is Elaine Arnold, Maddie Deppie, Isabella Brozak, Taylor French, and Annie Johnson.
Health insurance in England is primarily the National Health Service. This type is a single payer and tax funded system. It is financed through general taxation and some national insurance contributions. NHS provides universal coverage, so everyone who is a legal resident of England has access to healthcare services that are mostly free. Medical care in England is not based on the ability to pay, but by clinical need. Some benefits of this system is that it covers most medical care like doctor's visits, hospital treatments, emergency care, and vaccination/preventative care. Prescriptions are free for children under 16, people over 60 years old, pregnant women, and new mothers, and people with certain chronic conditions or low income. Dental care is not free, but the cost is subsidized depending on the treatment done. Vision is free for children, older adults, and some low-income groups. Other people will just pay an affordable fee. With this system, patients can choose their practitioners, hospitals, and specialists. Emergency treatment in hospitals is always free for everyone, including visitors. In England, supplemental coverage is available. It is completely optional since the NHS already provides comprehensive care. Most people buy it to get faster access to non-emergency treatments or surgery, choices of their specialists in hospitals, private hospital rooms instead of shared rooms, shorter wait times, and additional amenities like more comfortable upgrades or private recovery facilities. It's purchased from private insurers and employers. Sometimes will offer it as a benefit package. People can choose different levels of coverage from basic, like hospital care, to comprehensive, like outpatient, dental, and vision coverage. The premiums for this depend on age, health, and coverage level. Only about 12% of people in England have private health insurance, and many of those people will still use NHS for emergency care, doctor's visits, and long term conditions.
So, England's financing for healthcare is typically through taxation. It's usually universal through most people, unless there's like small copays, which I'll get into in a second. So, it's financed by the National Health Service, which is through general taxation supplemented by national insurance contributions that flow to the Department of Health and Social Care. This then allocates budgets to England's National Health Service and local commissioners. There is no insurance style premiums for core coverage, and most care is free at the point of use. Um, a small share of revenue comes from small patient charges for specific services, as mentioned earlier, such as things like prescriptions. Um, and then, just to get into the specifics of these cost sharings, um, it is prevalent in England's healthcare, which means while the healthcare may be universal, there are still some charges that the patient will sometimes face, such as things like prescriptions. For prescriptions, there's a flat copay of £9.90 per item, and for things like dental care, it has standard national health insurance dental bands, which just means how much you'll be paying for dental care. Band 1 is 2680, band 2 is 7350, and band 3 is 319 and 10 pence as of April 2024.
Next, we're going to talk about affordability in England. So, for patient cost, healthcare in England is largely affordable due to their use of national health insurance. So, services are free at the point of use for outpatient and inpatient hospital services, and prescription drugs are subjected to a co-payment of about $12.50 in United States dollars. Cost sharing is very limited. Most healthcare visits and resources are covered through the NHS. So, citizens of England typically aren't burdened by healthcare costs due to these free visits and also low cost of prescription drugs. England also makes exceptions for vulnerable groups. I found that children under 16, students aged 16 to 18 in full-time education, adults aged 60 or over, pregnant women or new mothers, people with low income or on certain government benefits, people with chronic conditions who qualify for medical exemption certificates. These people are typically exempt from paying for prescription or other healthcare costs. And in 2016, 89% of prescriptions in England were dispensed free of charge. There is also the NHS Low Income Scheme, which helps low income individuals with healthcare costs such as prescriptions, glasses, dental care, and travel to appointments. So England really works with their people to make sure that they can afford care. To contain costs, they have a national health budget that cannot be exceeded. This NHS budget is usually set at the national level and in a 3-year cycle. These are set to monitor financial performance and also limit overspending. They also support the increasement of generic drugs to lower costs and take away from buying the on-brand drugs. They freeze staff pay increases, they reduce DRG payments for hospital activity, and they also reduce administration costs.
Hi, so next we're going to be talking about the quality of care in England. So in England, the overall quality of healthcare is strong and is pretty similar to what we see in other developed countries within the OECD. Clinical care itself is genuinely high quality, meaning that when patients do receive treatment, the care is effective and well coordinated. There are, however, still challenges. One of the major issues prevalent in England is the rising burden of chronic diseases such as diabetes, hypertension, and severe allergies. There are also noticeable health inequalities where outcomes differ based on factors such as ethnicity and socioeconomic status. So over on the left, looking at the key health outcomes, we can see that life expectancy is around 79 years for men and 83 years for women. Infant mortality is relatively low at about 3.8 to 3.9 deaths per 1,000 live births. Comparatively, maternal mortality is also pretty low at about 13 to 14 deaths per 100,000 pregnancies. So even with these strengths, inequalities across the populations continue to affect those who experience better or worse health results. Chronic disease is a major factor in these inequalities, so about 10% of adults in England have diabetes and 11 to 16% have hypertension depending on the region. 30.4 to 36% of adults report having severe chronic allergies, and these conditions require ongoing care and place a continuous strain on both primary care providers and hospitals. So overall, England's healthcare system delivers high quality care, but going forward, the most important priorities are improving prevention efforts, reducing health inequalities, and managing chronic disease more effectively.
Healthcare providers such as doctors, nurses, and other staff in England generally work for the National Health Service, or the NHS, which is a publicly funded system. These providers are considered public employees, and the government regulates their pay, working hours, and training pathways. They're often respected and valued by the public, but many have expressed frustration with workload pressures, staffing shortages, and funding cuts in recent years. As for medical education, England is much more affordable than the United States, though it's still expensive for students. Tuition for United Kingdom students is capped at about €9,250, which is around $11,000 in the US. Medical school lasts 5 to 6 years, and students can access government-backed loans. For international students, fees can range from €30,000 to €50,000 per year. Admission is highly competitive, but the system aims to be accessible through standardized exams and widening participation programs for disadvantaged students. Compensation is standardized by the NHS, with residents making €32,000 to €63,000 annually, specialist doctors making $90,000 to $120,000 annually, and general practitioners making $70,000 to $100,000, depending on patient load and location. Compared to U.S. doctors, pay is lower, but providers in England don't graduate with heavy debt or face malpractice insurance costs as high as in the U.S. Provider satisfaction in the NHS has declined somewhat in recent years due to heavy workload and staff shortages, pay disputes and strikes, and burnout and pressure from rising patient demand and long waiting lists. However, many providers still report high satisfaction from helping patients and working in a publicly funded universal care system that aligns with their values.
One policy strength is universal healthcare coverage. In England, they have a universal healthcare system that is funded through taxation. Its principle is that healthcare should be available to all based on need, not the ability to pay for care. This is a policy strength because this system ensures that all residents have access to medical care regardless of their income. It improves population health since people are more likely to get preventative care, vaccinations, and early treatment. And it can promote equality and justice, the idea that healthcare is a right, not a privilege. The benefit this could have in the United States is that it could reduce financial barriers that come with getting care. It can improve health outcomes through more ability to get preventative care and improve the access that people have to getting care.
So one strength we see in England is subsidized medical education. So in England, medical education is heavily subsidized, and this encourages more people to join the healthcare system and also alleviates the stress of student debt. So by encouraging more people to join the healthcare system, there will be a decrease in burnout rates and also an overall smoother system. And this is because since there are more employees in the healthcare system, work can therefore be better distributed and it'll be in a better fashion, which will reduce stress. So I think this will benefit the United States because we have talked about in class how rural areas lack accessibility, and just overall in our country we have a lot of accessibility problems. So by implementing this, we can encourage more students to join the healthcare system, which could therefore make healthcare more accessible because there would be more employees that could work in rural areas and just fill our hospitals.
So one of the other strengths that we see in England is their national price negotiation for prescription drugs. So in England, the NHS is able to keep medication costs low because it uses a national price negotiation. And this is done through an organization called NICE, which stands for the National Institute for Health and Care Excellence. So what NICE does is they evaluate how effective a medication is and whether the price reflects its actual benefit to patients. So if a drug is too expensive, the NHS can negotiate with the manufacturer to bring the price down before approving it for widespread use. And this policy is a strength because it keeps medications affordable for the public and prevents pharmaceutical companies from charging excessively high prices, and just overall ensures more equal access to essential treatments across the population. So this could be a benefit to the United States because if the U.S. Adopted a similar model, it could significantly reduce out-of-pocket drug costs, which are a major contributor to medical debt. It could also improve medication adherence, especially for patients with chronic conditions who need that ongoing treatment. And overall, it would help make necessary medications more accessible and affordable for more people. Okay, so moving on to another strength that we found, a policy in England that we think could really benefit the U.S. is the integrated electronic health record system. So in England, most healthcare providers use a shared digital record, so a patient's medical history, medications, and test results can be accessed securely across clinics and hospitals. This means that when patients switch doctors or see specialists, their information follows them automatically. And this system is a strength because it improves communication, reduces medical errors, and prevents duplicate tests, which saves time and money. It also supports more coordinated patient-centered care. So in the United States, health records are often split between different systems that don't communicate well, which can lead to confusion and higher costs. If the U.S. adopted a more unified record system, it could really reduce administrative waste and improve safety and just overall make healthcare easier for patients to navigate.